Okay, good evening. Good evening to all. This is Talk to the Doctor or Ask the Doctor a Question from Tustin Longevity Center here in Southern California. And family and friends gather and we try to make available from a standard medical point of view how we would approach some of these alternative methods in management, how we would marry the standard medical with Eastern medicine. And we have a lot of experience with this. Thank you for checking the sound, Amila. And so we invite you all to ask your questions. And I think last week I forgot to take a screenshot of the questions that I had missed. Remember, there seemed to be some kind of a disconnect on my side. I didn't know that you were still on, but I apologize for that. I didn't get the screen questions. But we'll start today. Again, this is not meant to be specific medical advice, but general concepts from integrative doctors with standard medical training. We here at Tustin Longevity Center, there's 5 of us. We have a naturopathic physician, Dr. Kaur, who is very wonderful. We have Dr. Mitchell, who is our gynecologist and also practices natural hormone therapy, as well as us. And we have Dr. Merrick, who is running our thermography. She's continuing where Brenda Witt had stopped. And so she does thermography here. And she's a standard medical doctor doing integrative care. We have P.A. Patel, who is excellent now and well-trained in doing the integrative approach to standard medicine, and myself, Dr. Ellithorpe. So let's start with the questions. Let's see, it starts with Sarah saying, can essential oils be endocrine disruptors? And I'm going to say there is benefit from essential oils, but in unskilled hands or in products that are not well produced, there can be ill effects. I don't think they're disastrous or anything life-threatening, but the answer is oils can become rancid and quality of product becomes questionable if we don't have some regular testing. And so I'm all for essential oils, some natural benefits from them, but we have to have a standardization. So I'm going to say, yes, they can be, but in a quality product, it should not happen. The next question, Susie says, over the past 10 years, vertical ridges have appeared on both thumbnails and ring fingers, same location, and contiguously crack and split down the middle. Could this be an iron or a B deficiency? Yes, there are many nutritional deficiencies, shortcomings that manifest in the nail beds and the toenail beds. And there's a lot of trauma on your thumb as something that you're using multiple times a day. And the capillary bed that feeds the base of the nail can come under trouble from what you're eating, too many carbs, clogging up, blocking all the blood flow, so it gets sticky through the capillaries. Food allergies can clog it up, not drinking enough water. Digestion and absorption of nutrients begins to diminish as we age in particular. People with blood type A have a greater risk of having poorer digestion because of their just general trend of A-type blood. People don't digest fats and proteins as well. So yes, this can represent a wide swath of nutritional deficiencies. But also, the other things are important, such as the microcirculation and the water consumption and the carb consumption, whether you're active or not, getting enough sleep as well, protein digestion. So all these things come into effect. So show that to your doctor. and have your doctor do a micronutrient assay. We have 2 labs here that do that. We have the SpectraCell, which we've done for many, many years. But I am starting to use the clinical nutrient assay of late, and so they can help us look at these things for you as well. So clinical nutrient assay, CNA, or have them order a SpectraCell, and we can begin to try and help you. Find out your blood type. Your age matters. If you're older, you probably should have some cardiovascular, microvascular assessment done. And let's see. Grant is on the line. Hi, Grant, my great nephew. Glad to see you. God bless. SM, could you help? Your help is very appreciated. I have been told I don't digest fats well, digesting fats well. What is best for that? Well, I would suggest a digestive enzyme that has lipase in it, betaine, hydrochloric acid, the proteases as well. So I use the company called Orthomolecular, and the name of their digestive product that I've been using over 30 years is called Orthodigestzyme. Orthodigestzyme. And it has, I use it all the time. This is my little bottle here that I use. I got my rubber band on it. But that's the name of it, Orthodigestzyme by Orthomolecular. And it has in it the proteolytic and lipolytic enzymes in it, and the hydrochloric acid as well. So that's what we use, and that should be very helpful. There's another thing in this that is helpful with emulsification of fats, and that's ox bile. So this has ox bile in it as well. All right, well, hopefully that will help you, but that's what you need to get in your supplement there. Everyone, as we get older, you know, I'm taking it now. I'm not a blood type A, but I'm almost 70 years old, so I'm not digesting like I did in my teens, my 20s and 30s and 40s. So there you go. Dolphin, I'm kind of stressed out that my husband got the jab. Dolphin, you're on every visit saying this. I would say, yeah, you're stressed out. Is there a dose of ivermectin I can give him if he has a bad reaction? Any other advice? Well, the ivermectin will bind with the spike protein, and so that's a reasonable thing to seek out a doctor to talk about getting ivermectin, especially if you've been vaccinated and you're having vaccine remorse and you want to protect yourself. The ivermectin does bind it. Hydroxychloroquine does bind it. Quercetin does bind it. So you could take quercetin, 250 milligrams, 400 milligrams twice a day, and that would be very helpful. Being low carb, drinking your water, keeping the systemic enzymes like vascuzyme or vitalzyme, so there's no blood clotting, and not eating late at night, exercising. But yes, Dolphin, the ivermectin would be valuable. If you could also get chelation therapy, we do have chelation, and you do not have to be a patient here. We do have a walk-in concentration that you can request that is safe, and that also improves microcirculation, and the polar aspect of the EDTA, ethylene diamine tetracetic acid, is an anion. It's negative, but the spike protein is a cation, positive, and so that's another methodology that you could use to help pull it out. Hopefully that helps. Do I need to avoid contact with his breath and skin? I'm going to say I don't think that there is a significant risk for exposure. And I would say that fear is damaging as well, Dolphin. Living in fear is a damage to your immune system. And it is right and proper to love and walk in faith, hope, and love. And I have just never seen anyone who has a vaccinated spouse in any way significantly harmed or injured by their spouse that was vaccinated. And I have maybe 15% of my patients early on started getting vaccinated out of concern for they were taking care of their elderly patients, or they thought it was their duty to try and reduce risk for themselves. Now they're looking often back with some vaccine remorse use, but doing all these things, taking the ivermectin and taking the enzymes to prevent microclots, drinking plenty of water, being low carb, don't eat late at night, EDTA, chelation, all these things are a great blessing. So all my patients have done well. Even the ones who have been vaccinated really did not seem to have any harmful side effect. So I would not live in fear, Dolphin. I would love your husband as we're supposed to do, and just walk by faith because I haven't seen any harm from my patients. Chris, what is the best advice for profuse armpit sweating? I do not use conventional or antiperspirant. Hyperhidrosis is the name of that. That's called excessive sweating. And this is a autonomic nerve dysregulation. It's possible that you have a hypersensitivity to the sympathetic tone. And very often, because I have had people that have had this, using a sympathetic tone modulator, something that makes you less stressed, such as antidepressant drugs have been found to be very helpful in this. So I would talk with your doctor and tell them the term hyperhidrosis, and talk about the sympathetic tone and some of the things that we can do to block that. And that's in the neurotransmitter management, which are often antidepressants. What are natural antidepressants? That would be things like vitamin D at a very good dose as a natural antidepressant. Magnesium works as a natural antidepressant. Certain herbs like ashwagandha is a natural antidepressant. So magnesium is a natural antidepressant. Lithium orotate is a natural antidepressant. And so there are some natural things you could do. There are some essential oils that work as antidepressants. So exercise is a tremendous antidepressant, but that also will probably stimulate your excessive armpit sweating. So my suggestion is if you want a quick, rapid fix, you have to go to a doctor and talk about some antidepressants for a while you work on maybe some alternative integrative therapies as well. Hopefully that helps. All right, Chris went on to say, I also seem to be waking up quite a bit during the night with night sweats. Well, I would like to know your age. I would like to know your blood type. There's many things, going on, your life situation. And you have to get a good night's sleep. Otherwise, you'll be in a chronic stressed tone, and your sympathetic side will be on a hair trigger level. So dutiful exercise, maybe taking some magnesium at night to help you sleep deeper, some ashwagandha as a natural herb from a reputable source. These things might be helpful with modest exercise, and see if those things don't help you. And pray and your spiritual self. You've got to work on your spirit, your soul, and bring your soul and spirit to peace. These are important things. So have that kind of a pattern, and talk to your doctor about those things. And we'll see what your hormone levels are. If you're an older person, maybe your testosterone level is falling and you're getting climacteric, just like a woman would get that. Or if you are oxidatively stressed and there's a lot of toxins in your body, even younger men can have very lower testosterone levels. So all those things matter. So Chris, see your doctor and or one of our doctors here and talk about those things with your local doctor. All right, Grant says, how about glyphosate and it permeating every single food and drink, even spices and supplements? It's pretty scary to see how far it goes into everyone's diet. Just curious if you have seen that. There is a man by the name of Mike Adams with Natural News, the Health Ranger, and he is a scientist by training, and he has been assay testing products for glyphosate screening. And so there are supplements and there are sources that you can get that are free of it. So definitely you want to stay away from genetic modified foods. You want to try and eat as organic as you can and avoid those things. This is true. This is a something that needs, more publicity. But in general, in our clinic here at Tustin Longevity Center, all 5 of us healthcare providers are very focused on trying to eat at home, to try and not eat out where they're going to be using the buns on these hamburgers from wheat sources and flours that have the glyphosate in it and their potential harmful effects, their known harmful effects. And so the more you eat at home, the more the home traditional actions are taken up again, like cooking and eating at home and the family time and the reassurance emotionally that gives you and your children, patterns that are reproducible. These are all very helpful. But yes, glyphosate is really a poison. It's a pesticide, insecticide, and intercalating it into the genome of these grains has made this something that increases the yield of these industrialized farm techniques, but it's harmful for us as human beings. So thank you, Grant. Dolphin, thank you for answering my concerns. I am your patient and my husband would never get an IV or healthy treatment. He eats junk food. That's why I'm concerned. Well, Dolphin, all the more reason to love him and to be patient with him and to just walk in faith, hope, and love for the time and the degree of health that he has. You don't know how long no one knows how long we have on the planet. So it's always going to be honored how well you treated your spouse with faith, hope, and love. Okay, so good for you. Stay concerned, but turn that concern into faith, hope, and love and actions of unconditional love. Yeah. Debbie says, hi, Dr. Rita. Is there any benefit from taking collagen powders and protein powders, or are most of them junk? Thank you. I'm mixed on that, Debbie, because I've been involved in this since I was a child, and my father was in food research. So I know that the sinful nature in all of us corrupts, everything from our own lives, and we harm our marriages, and our habits are passed on to our children. And the cheating that goes on in the food industry and the pharmaceutical industry, like Grant was bringing up the glyphosate in the food industry. So if we have a humble heart, we have to understand that not every protein shake, not every collagen producer is a quality product. We need a system whereby, like the Health Ranger, Mike Adams, who created his own assay testing, can test these things, and that can be done all throughout the country. The FDA and the CDC and the NIH are captured 3-letter organizations, amongst many others, that are bought off by lobbying interests, so that they no longer are altruistically looking for caring for people, but are looking to care for long-term relationships with their lobbyists and their own income, and we all fall short and we can succumb to the money pit. Very often this is the cause. So can I endorse anything outside of what I've tested? I can't, because I have seen so many disreputable products, both in the pharmaceutical side abusing people and in the alternative health food store taking advantage of fear and cheap marketing. The only one that I'm familiar with that has any research behind it is the orthomolecular product that we have, and that's because of the testing with orthopedic surgeons on the bone and tissue integrity, measuring the size of the collagen particles itself, tracking its absorption ability through the gut delivery system, and that's our chondroflex and collagen products. So that's our glucosamine sulfate, chondroitin sulfate, chondroflex, and the it's married to the product called collagen. Now, I've studied that and that works. Now, do you have to use it? I am not using it because I eat such a rich protein diet every day of my life, which you're to get the collagen and the chondroitin sulfate from your foods. And so I'm eating lots of meat and chicken and protein products, and I use my digestive enzymes liberally. I'll use 4 digestive enzymes every time I eat something. Even if I eat my doctor's nutrition bar, I will have 2 extra digestive enzymes. So I probably consume maybe 7 to 10 digestive enzymes every day. And my collagen elastin is not dropping a lot. You know, you can see some of that aging, and the drop in my neck is showing my age here. But in general, I think it was designed that we should get this collagen out of our diet from digesting appropriately. The only product I can endorse is the one I'm studying. I wish we would decentralize government and just restore it to its minimalist, limited government, more individual responsibility, and with God's help, a better world. And therefore have, you know, your county privately owned assays, and if they're not doing good work, then they'll lose the business, and then their economics will inspire them to do the right thing. Like a doctor who is a private physician will want to try and do the right thing, because if they don't, they can a lawsuit can be brought for malpractice against that physician. If they're hiding behind indemnification, like all the vaccine indemnification protection, then there is no incentive other than, let's make sure I have vacation next year and I have a raise coming, and I'll just ride this government protection, government job to its end, and then I'll get my retirement, you know. And this should never be. There should never have developed that kind of stuff. So we need more assays on the food and the quality of the food and so forth. Okay, so Deborah said, what are your thoughts about molnupiravir? How do you pronounce that? Molnupiravir. Molnupiravir is the new Merck product that is an oral medication that is designed to be an antiviral. My thoughts about it are there is a significant record of genetic mutations in the users of this in their animal studies. This drug has been around I don't know, at least 10 years. This is no new developed drug. It's just them taking out of their drug uh, uh, refrigerator, the various things they've worked on, and they're trying to use it as a antiviral for COVID type mRNA viruses, coronaviruses, which are RNA viruses. Now, because of this known mutagenic, and it operates that, I don't know the chemical name of it, but molnupiravir is a mutagenic agent that intercalates itself into the virus particle to try and destroy its ability to be read transcriptase by the messenger RNA reading it. So that is what it does. It is a gene disruptor. They say it's exclusive to the virus at hand, but they found in the animal studies the offspring with skull in particular and teeth, mouth deformities of the animals. So that is something that I think we should be mindful of, especially when we have 35, 40 years of ivermectin, more years for hydroxychloroquine, with these tremendous safety records, these tremendous broad spectrum application. I know with ivermectin, there have been over 4 billion doses in pregnant people and nursing mothers and all ages of people with no significant side effects. So why even consider molnupiravir with its known mutagenic impact on the animal studies done years ago on it? Why even try that? So that's where I'm at. And once again, we're getting this news clip on it rather than getting scholarly debate on it and articles. So we doctors are being treated like little, popcorn eating, news watching individuals, and we're just supposed to go with news clips. This is ridiculous. This is insulting. It's more than ridiculous. All right, so Chris said thank you. Thank you, Chris, for joining us. Deborah goes on to say the supplements for sight from orthomolecular directions say to take 1 capsule. Can I take more than 1? Yes, you can, but I don't have it in front of me right now because the vitamin A in it is the concern to the limitation on the dose. That's a fat soluble vitamin. So Deborah, I'm going to have to look at the orthomolecular foresight and think about whether or not doubling the dose is appropriate, because I have to check the vitamin A level in it. By the way, I'm not, if you're on Juice Plus, the vision, the protection of your lungs from oxidation, along with a low-carb diet, enzymes, plenty of water, avoiding your food allergens, will help you have great eye exams. I just had mine a few months ago, and the optometrist was just stunned to see that I was almost 70 with no sign of any lens cataract formation, and really no floaters to speak of. And remember, I had that one big floater, I don't know, 7, 8 months ago. And it might have come as a result of having a cold, which my antibodies that I did last month in September were humongous. I have tremendous antibody protection to SARS-CoV-2 according to their lab techniques. And maybe when I had got exposed, maybe some person exposed me, fine, but I had no serious symptoms. Maybe that created a tiny little clot, and that created my left eye floater. And that's why I went on a 5-day fast extra this year. And after that 5-day fast, in which I take all my same vitamins with my Vitalzyme 5 twice a day. I think I did it 3 times a day. and I did some chelation and a high-dose vitamin C. That huge chunk just dissolved in my vision field, and so it's all gone right now. Praise the Lord for that. So Juice Plus should be enough, and that's my thought on that. I'll have to get back with you next week on the total dosing. Let me make a note to myself on that. Alrighty. So I want to check the vitamin A level in the dose of Foresight. Okay, very good. I got that as a note to myself, Deborah, so I will check on that. All right, now the next question is, Grant goes on to say, thank you for knowing about glyphosate. Glad to see you are still doing well. If you want to talk more about some of the things we found out in our lifestyle, give me a call sometime. Yes, Grant, I should try and come out there and visit my sisters and my family. I need to do that. Deanne Smith says, as a very healthy 83-year-old just diagnosed with osteoporosis, and the recommendation is for reclassed or Provia, what is your protocol for your older patients at Tustin? So I'm pulling out of the drawer. I have this article, a bone density report on a 80-year-old, lower 80-year-old woman. And I'm looking at from 2012 to 2020. And her bone density has improved almost to the point where she's normal now. And that's without Provia or reclassed. And so we use natural hormone replacement therapy. We try and get the estradiol level at about 80, 90 to 100 micrograms per deciliter. I use the topical creams. I make them here, estradiol pure, bioidentical. And then I use progesterone at night to help get deep sleep. I encourage them to stomp like they're throwing a temper tantrum and stomping their legs like a little angry girl for 30 seconds to a minute every day. I ask them to drink enough anti-inflaming water, I ask them to take the enzymes. I ask them to be on high-dose vitamin D, and I get their vitamin D levels to 100, 110 range, and they're very stimulating for bone health. I ask them to avoid any inflammatory diet, food allergies, to drink their water, to stay low carb. And I do not use any special minerals. I do check their minerals. Sometimes I will give them my bone health that does have, like strontium and boron and things like that in there. But so I have proof here. I've covered up her name so you can see it, but you can see how nicely her numbers have gone. You can see from 2012 all the way up to, we've gained a whole point over the years. So this is very common. This is what we see, and we thank the Lord for it, that all these natural things are so helpful without the risks of some of these drugs creating other bony problems, osteonecrosis and such like that. So Deanne, hopefully that's what we can do. Deborah says thank you. All right, thank you too. Any solutions for cracked feet, or is it just genetic? Cracked skin on the feet on a middle-aged person. Those are usually fatty acid problems. It also, I would want to know if you are very much overweight, because pound per square inch will make the thickness of the calluses on the feet thicker and the blood supply more distant. Lack of drinking water. So I would take pure and essential oils. I would find out my blood type and see if you're a blood type A. You might need the digestive enzymes so you can absorb your fats so your skin will stay more supple and soft and that means also the soles of your feet. My feet, I am very happy to say I don't have those thick cracking anything anywhere, because I've been blessed to be raised by a father in food research, and my heavenly Father kept me humble, I guess, so that I would be happy with just a modest lifestyle as a integrative doctor, and learn to do what's best. Essential oils, listen, we're made out of fat and protein. We're not made out of starch and fruit sugars. None of this is starch or fruit sugar. It's all fat and protein. Now, yes, we are studying in research what is called a glycocalyx. It's a teensy weeny. It's like putting eyeshadows on your eyes, but the structure of who you are and your presentation is all there without any eyeshadow. So there is a glycocalyx, we understand now, on the very tippy top of a cell membrane. But in general, the structure, the power of what we're made of, and your blood vessels is fat and protein, 50% each. Your brain is 75% fat. These are phospholipids. You only get this from eating really meat and fish and the chicken with the skin on it, and your pork roast, and your shrimp, and your lobster, and your crab, and your eggs, and the yolk of the eggs, and the bacon. Getting these things structurally into your diet, digesting them well. Nuts and seeds will give you some of the essential fats. And we're a nation that has eaten too many carbs. Most Americans are pre-diabetic, and diabetic explosions are occurring in our youth. We are having more non-alcoholic fatty liver disease in our children, more cancers in our children, more autoimmune disease in our children, more neurological dysfunctions in our children than ever has been seen. We are not repairing our cells and our immune systems the way we should have been. So therefore, I suspect that you have a poor fat, essential fat, and you're low on this. Water's essential. The microcirculation to your feet that take a pounding. All these things matter. Enzymes matter. And there you have it. That's what I would say. Jana says, is chelation good or helpful for someone who has a pacemaker? Yes, absolutely. Yeah, you can take EDTA chelation even if you have a pacemaker. Absolutely. That implies that you already have microvascular disease, and the electrochemical signaling for the rate of the depolarization and repolarization of each cell is being interrupted, so that not a smooth activity is going on, so you're not getting the essential synchrony of the ventricle to the atrial contractions. Therefore, EDTA chelation can tend to help preserve the health of the cardiac tissue and microcirculation everywhere, and is quite safe with a pacemaker. All righty. EH says no. What did I ask? Oh, so I probably asked, are you very heavy? And because very heavy people have a thickened and cracked sole to their foot. Okay. All right, good. I'm glad you're not overweight. Amila said, copper supplements of 1 milligram give me insomnia. Is that pretty common? I can't get copper from food because I don't eat dairy or nuts and seeds. All right, so then she goes on to say, when I stop copper supplement, insomnia goes away. Very interesting. I haven't heard that, Amila, really. The copper-zinc ratio is very important. And unless you're deficient, I don't think I would take supplemental copper. But Amila, if you see a doctor, if you can get a clinical nutrient assay, CNA, they do the copper and the zinc measurements. If you do a SpectraCell, they do the copper and the zinc measurements. But I don't think I would be trying to supply it necessarily without having a doctor who understands how to check those things. And it should be in your food. It should be, you could get that in a multivitamin nutrient that's balanced. So that's what I would do. But no, I've never heard that before. Deborah says, what is the difference between a medical doctor and a naturopathic doctor? The difference, Deborah, is a naturopathic physician has gone to the same, years of medical school as a allopathic. Allopathic physicians like myself are the standard regular medical doctor who are drug-based. We're taught drug therapies and prescriptions and chemicals. We are not taught nutrition. We are not taught herbal medicine. We are not taught ancient healing methodologies. So naturopathic physicians are taught these things about Ayurvedic medicine, essential oils, acupuncture, Bach remedies, and much, much more on nutrition and nutrient IV support. So Dr. Kaur here is a naturopathic physician. She's excellent and well-trained. And I'm so proud. One of my, Dr. Kaur came here many, many, many years ago as a teenager. And she was just starting college. And she was so happy with what she saw happening here. She changed her major at the University of Irvine and became a chemist because she learned I was a biochemist major. And then she did well, and she went on to medical school, and then she came back to work here. So I feel like I gave birth to a doctor, and a very good one at that. Now I have my second person who has been happy working here. If you have been here, his name is Noah. He was working in my shipping department and natural supplements. A very intelligent young man. He also went to medical school now, and he's going to come back here, he states, when he's done. So I'll have 2 children, I think, that have been, raised, and what a blessing that is to me. All right, so I hope that lets you know the difference between a medical doctor and a naturopathic doctor. Actually, I think the naturopathic doctor is better. 6 million, hi, how are you? Saying hello. Christina says, can Argentin First Aid Gel help hydrate the skin? I have been trying to apply it to my son's dry hands. You know what I think it will protect them from getting secondary infections. If your child has eczema and dry and cracking hands, that is either a food allergy or a fatty acid digestion, and you need to check the blood type of your child. That may be an early sign that there's a leaky gut and foods are becoming inflaming to them. But Argentin gel is okay, but what I really would do is I would get some Parent Essential Oil, and I would PEO. We have it here. I think it's available on the internet. Dr. What is his name? Peskin, Peskin, is responsible for the assay testing for quality and no rancidity. So the Parent Essential Oil is a liquid or a capsule, and you can put 1 drop on the boy's hands and put that, and then you can get Argentin as a spray to prevent infection, because that's literally what the skin is made of, is the Parent Essential Oil material. So it's very helpful. But I would see a doctor or naturopathic physician who is familiar with dry skin, eczema, especially on the children. And that would be right up Dr. Kaur's alley. She would be very happy to see a child like that. And she'd be testing for blood type, digestion, food allergies, and she'd be talking about the oils, all these things. So find a doctor who will do that, Christina, and hopefully that will help. Jana says, the pacemaker is only being used 1% of the time. Thank you. Wonderful. So you must have a on-demand. Yes, so very good. And I would do chelation. I would see a doctor who's trained in it, well familiar with it, and can explain to you the value and perfusion help of the tiny, tiny, tiny microcirculation throughout your whole body. Wonderful. Amila said, I did the SpectraCell and I was borderline deficient in copper. All right, then copper is in some nuts and seeds. If you're sensitive to that, you know, I would have to look that up in my food value book, my Netter's book on Encyclopedia of Foods. Of course, you could go on the internet and look up foods that are rich in copper. But, you know, how long ago was that? Because I usually give a multivitamin that has copper in it. And if you are coming here, Amela, then you may be already stabilized on that and not to worry about it. So if you're my patient, come and see me. If not, see another doctor to recheck your essential, either the CNA or the SpectraCell, and we'll go from there. 6 million says, is there a problem to go to a normal dentist versus a holistic dentist? Due to insurance, what should I avoid when going to a regular dentist? Well, it depends on what you're going there for. If you're trying to get your amalgams removed, they're not going to put up a dam for the outgassing of mercury as they drill it out and have a suction for that. So if it's for other routine dental work, I think they're fine. I would ask them to try and avoid implants or root canals, as these are very problematic in dental health. They tend to recommend antibiotics too liberally, and that can be a challenge for your gut and immune system in your gut. But I would say for the most part, you're going to be fine, 6 million. And it's very good to keep your teeth in good working order and not to let them break down, because they're a source of bacterial infusion into your gums and into your bloodstream that is very much associated with plaque formation in the coronary arteries. So yeah, dental health is very important. How long does chelation therapy take? A standard chelation therapy is about an hour and a half. So hopefully. And then Debbie said, I was wondering where Noah went. Noah went to medical school at a naturopathic medical school. I'm not sure if he went to Bastyrs up in the northwest. I think that's in Oregon, or if he went to the Naturopathic School of Medicine in Arizona. I don't know which one, but I know he went to naturopathic school, and I favor that. So there you have it. All right, so it's 6:50, and we've done quite a bit. I don't see any more questions. I will be here again on Wednesday at 9:45, and I will try and look at some of those questions as well. Debbie added, I was told to have my mercury fillings removed and not have chelation until I have them removed. Well, you heard wrong. That's nitpicking and hair splitting. EDTA chelation is really life-saving. And as you can see, it's very costly to pull out your amalgams. So I've been chelated, and I've always been around people who have done chelation, And we know the vast majority of baby boomers, people in their 40s and older, have had the amalgams put in. Since roughly 1990, more and more had the, what is the name of it? The composite that looks more white being placed in there. Yes, it's a toxin, but definitely you need to do chelation. And when you can get your mercury-laden amalgams removed, then try and get chelation afterwards as well. All right, folks, my voice is going a little bit. I'm going to say goodnight, and I will see you Wednesday at 9:45. And we'll do a half hour then, and I'll see you next Monday at 6 o'clock till 7. So I want to say thank you for being a part of this video series. Thank you for your questions. Thank you for sharing and liking. Thank you. You know, you can write something in the comment section. I do try to look there and answer questions there too. And share it with your family and friends. And maybe if we're helping this way, it's important for you to take care of your health so you don't need to go see a doctor. That's the big thing. I never want to see a doctor. All right, so God bless you all and take care. Good night.